Almost all your body's potassium, like 98% of it, is kept inside of your cells thanks to the sodium potassium ATPase pump. When you give a beta 2 agonist like albuterol, that pump speeds up and it sucks the potassium into cells super quickly and it drops the potassium levels in the blood. It's called transient hypokalemia. It just means the potassium has been redistributed. So if you have like an asthma patient who's on frequent beta agonist therapy, and then all of a sudden he's got low potassium on the labs, despite no obvious source of loss, it's dangerous because that sudden shift can cause arrhythmias. So here's our example, 26-year-old man, history of asthma. He's using albuterol, beta 2 agonism, short acting. And look at that, hypokalemia. What's the mechanism? Well, it's the beta 2 receptor activation. And they could give it to you a little bit more difficultly by saying, okay, it's actually just this influx redistribution of potassium into the cells. We know it's a beta 2 receptor activation, but it's that redistribution which causes this. Okay, some other trap answers like your renal potassium loss, that requires your diuretics and hyperaldosteronism. So just a different mechanism. Sweat loss, there's no reason to think that. That's only like extreme conditions of sweat loss, so that'd be a silly answer. Hypokalemia from poor intake is going to be rare unless it's paired with like other conditions or there's a reason to suspect they have a low potassium intake, but here it's clearly this other issue of redistribution of potassium. Respiratory alkalosis can cause your potassium shift, but this patient is likely acidotic. They have a CO2 retention because of their asthma. So it's not going to be like alkalosis, although, you know, that's a good thought. All right, so that sodium potassium ATPase pump activation causes that intracellular potassium shift because of these beta 2 agonists. If this is helpful, like and subscribe for more content. New question every single day.